right, Laura. So this was something that was pretty unexpected, and that was to do a spin class, kind of a ma ha 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 kind of where we are going to be talking about like the instability in the public healthcare system. I mean,
Right.
you know,
And we want America to be healthy.
I mean, we do.
We're just not sure that some of what's going on is the right way to do that. Can I just
That's
give
right.
everyone a shout out? If you have a bike, get on it right now. If you
Yeah.
just want to go walk around the block, go ahead.
Yeah.
Let's move our bodies, get healthy, and talk about instability.
Yeah, and what I'm going to do is I'm going to play some music in the background, and I'm going to kind of teach this a little bit like I do in my spin class. For those that don't know, I do teach spin. I mean, that's like one of my weird kind of things. I wouldn't say it's weird, but that's one of the things that I like to do. It's a lot of fun. So, you know, so we'll go through this. I'll call out some cadence and stuff like that. I'm not Cody Rigsby, sorry. I mean, it still could be a little spicy, but I'm not completely like him.
I like riding with Cody.
I mean, he's a lot of fun to ride with, like a heck of a lot of fun to ride with. But so today's episode is going to be all about Maha. Make miracle healthy again. There's been some really interesting choices that have been made over the past few months with the new administration and with RFK Jr., with Dr. Oz, all becoming a part of our new public health system here in the United States. I mean, Laura, do you have any thoughts?
I always thought the Surgeon General needed to be a doctor. Like a trained one, like qualified, like licensed.
Well, okay, fair. That's a really good point. But what about like the head of the Department of Health and Human Services? How's that?
I always thought that that was supposed to be somebody who embraced science as fact and not opinion.
Okay.
And I want to clarify that by saying scientific opinion is the answer based on the best evidence we have at that time. So scientific opinion can change if a study comes up that refutes something or there's a new technology. But in general, it's pretty heavily weighted in like reality, like the best reality we can find, not your beliefs or what you want to be reality.
Well, right. So what you're trying to say, I think, not trying to mansplain, just want to be very clear. What you're trying to say is that, like, usually science is rooted in some level of reality.
Yeah, like that's why I always liked it, because I'm not good with criticism, and so if my English teacher didn't like my paper, well, I wasn't going to go to that class anymore and put in any effort. I'm very sensitive like that. But it was hard for my math teacher to mark something wrong and for me to feel bad about that, because there was a right answer and a wrong answer usually.
Well, right, that's right. So you couldn't just make up an answer and then just convince everybody that the answer was correct.
That's right. If two trains are speeding towards one another and they are each going 700,000 miles an hour and they collide, what's the force? It's not two.
That's also true. Well, I mean, let's just kind of put this into perspective. So new administration comes in, they come into the Health and Human Services Department. There's a lot of controversy around RFK Jr. becoming the head of the Department of Health and Human Services, and some of the reasons why was because he's had a long history of being an anti-vaxxer or being very much, that may be overstated or maybe absolutely correct, but the other is that he has been very much a denier and a skeptic. And the skepticism around the vaccines have even extended to vaccines that have been around for decades, like the measles, mumps, and rubella vaccine, which is highly concerning because we're seeing an outbreak of measles. Correct?
There have been, right, so yes, I agree. The suggestion that we haven't done adequate safety studies is outrageous, because here's what we know. In the early 1900s, 10% of babies born in the US died before their first birthday, mostly from infectious disease.
Right.
Okay? Vaccines have saved 2 to 3 million lives globally. They're so safe that, my daughters are 3 months apart, and so the pediatrician used to get them confused. So there was more than one time where one of them was sitting on my lap, got all their jabs, and then he was like, okay, I'm ready for Zoe. And I'm like, that was Zoe. So then she would also get all of Apha's shots, right? Like,
Right.
I'm not concerned as a pediatrician and a mom, but now we've had almost 1,200 cases of measles. 3 people died. 95% of those confirmed, those are only confirmed cases. 95% were unvaccinated. That's outrageous to me.
So
That's
when we talk
heartbreaking.
about- it's heartbreaking because it's all preventable.
That's right.
When we talk about wanting to make the American healthcare system more stable, it's how can we get high quality care? Quality being defined as, or high value care being defined as high quality, low cost. You can't do much better than how vaccines have done for the American healthcare system and for the American public. And there's this thing, we always talk about the knock-on effects of either policy or the knock-on effects of even commentary. When you have the head of Health and Human Services making decisions like completely wiping out the entire vaccine review committee, and placing into the vaccine review committee skeptics, COVID deniers, and people with no background whatsoever in vaccines and immunology or virology, you create this environment where can you really trust what's coming out of Health and Human Services? And that's, I think, a really scary place for us to be in the United States.
It's not only can you trust it, what it is it's legitimizing truly harmful misinformation. That there's no arguing some of these things, right? You can have a theory about something. I can pretend that I look like I'm 29, right, and 50 pounds lighter, and it doesn't make it reality, right? Eventually, you got to look in the mirror. So
Right.
I think to give people who have had a history of being very vocal about non-mainstream scientifically backed fact, unfortunately gives them a platform, and it legitimizes what they're saying to some extent, and it makes people really question who to trust.
Well, exactly. I mean, if you look back during the pandemic, states that tended to vote more conservative had 2 things: higher levels of disinformation around COVID vaccine, and as a result, had fewer people take the vaccine. And the effect of that, they had higher death rates than places that did not, that had areas that tended to have a science-driven focus on vaccine adherence, prevention measures, etc. So you can see how, the commentary around the vaccine or the commentary around COVID or any other infectious disease becomes really important because it becomes infused into the common kind of societal conversation around vaccines and drugs and all these other type of public health issues. And then the effects can be disastrous. So, I mean, Laura,
Yeah,
is our healthcare system and public healthcare system right now unstable? What do you think?
I think it's about as unstable as we are.
Well, I think I'm okay, pretty stable. I mean, look at I can talk.
I mean, I'm going to tell you, back to COVID, here's a perfect example of when scientific opinion did the best they could with the information and understanding at that time. And yes, you can look back and say, oh, well, that wasn't really necessary. But we did the best we could, and then that opinion evolved. COVID really set off my instability. I was locked in a house with 3 children, all of whom require some learning support. Never again. God bless the teachers.
Man, tell me about it. I mean, we were all complaining just because we didn't have to go into the office. That was really not a complaint, but we were working from home. But it did create some isolationism that was associated well. So, not everything that came out from a public health perspective was perfect. And there were other effects of those things too. So let's talk about a couple things. I mean, we talked about RFK Jr.
Are we done with our warm-up? Do I need, what setting am I supposed to be on?
I mean, this is a pretty strong, let me kind of turn this up. I mean, this is Bad Romance from Lady Gaga.
Oh.
And if you're following...
Have you ever had a bad romance?
Cadence is in the mid-60s.
Where's my resistance?
Now, I'm not going to make you do any choreography, but if we wanted to, you could do the choreography.
I'm fucking dancing on my bike. I'll break a hip. Jesus.
Okay, I want you to turn up the resistance. 3, 2, 1, let's go.
Okay, lay your question on me. Let's see if I can talk and jog.
Yeah, I mean, okay, back to us. Sorry, Lady Gaga. But, so like, we've talked about some of the things that make it unstable, like RFK Jr. But what are some of the other issues that you're seeing that make the public healthcare system right now pretty unstable?
The lack of respect for the opinion of our major medical associations. You know, that's really hard to swallow when you've dedicated your life to helping people and wanting people to be healthy. I think some of we're going to talk more about this in another episode, but some of the nutrition advice, you know, a broken clock is right twice a day. They're not wrong. He's not wrong that we should exercise more and eat more vegetables. It's the raw milk and the listeria outbreak that's certain to happen. You know?
Or the E. coli outbreaks. Or the focus on things like raw milk and not vaccines.
Well, I mean, I gotta sit down, buddy. I mean, as a pediatrician, you're not sitting down yet?
No, I can do a whole class like this.
You're gonna do all class standing up jogging?
Of course not.
Oh, okay.
But this is Lady Gaga. I mean, this is like...
Oh, this is Lady Gaga, so we gotta dance, okay.
Yeah, I mean, we got to.
You know, I used to do a lot of writing for a vaccine website that was affiliated with Every Child by Two. Very, very, very difficult conversations. And this was, you know, years ago when vaccine uptake was still pretty high.
Right.
You know, 2023, 2024, we had a kindergarten vaccination uptake rate of less than 93%, which is sort of a critical threshold for preventing disease in our communities. And then COVID made it worse because people didn't understand that other vaccines take a long time to develop, not because it's hard, it's because there's no money. So if you throw Operation Warp Speed and suddenly money's no object, then you can produce vaccines based on old technology very quickly. But the COVID vaccine issues created so much more talk and suspicion that it's affected uptake across all vaccines.
Exactly.
Are we sitting down yet?
And we are sitting down. We're taking a couple of turns off to the left. Pick up your speed, though. I want that cadence right around 100. So pick it up.
You could want all you want. Doesn't mean you're gonna get.
Well, that's when you walk, you turn up the resistance. So we're doing it on the Peloton bikes right now, partially because we want to demonstrate a couple things. You can exercise and you can have a lot of fun doing it, and it's a lot more fun when you're doing it with someone. And that's one of the biggest benefits that you can have. Now, according to the American College of Lifestyle Medicine, you should really get about 150 minutes of moderate exercise. So what is moderate exercise? So right now, I am not out of breath. Now, I exercise every day, I'm a spin instructor, but if I were really starting to push it, I would start to get out of breath. So you really want to get to about 150 minutes a week of exercise where you kind of struggle to have a normal conversation.
You mean like
and
me?
sometimes we even say like difficulty with singing. So like if you're walking, you can sing, that sort of thing. But if you were like really pushing, you may be able to have a conversation. You probably couldn't sing. And I'm kind of getting there. So like, you want to get about 150 minutes. But here's the thing, that's not easy to do for a lot of people. There's a lot of things that are happening in your life, and like these bikes, they're expensive. Going to the gym is expensive. So we have to think about ways and build infrastructure to support people who want to get exercise. Laura, you live in overseas. What are some of the things that you're seeing over in Europe that they are doing to kind of support exercise so that people are getting more activity?
Well, I think people underestimate how much activity you can get just walking up and down the hill taking your kids to school. How much exercise you get having 3 children under the age of 3.5.
Right.
Walk to the grocery store, take the stairs instead of the lift. There's so many ways to incorporate just a little bit of activity and movement. I will tell you, everyone knows I'm 53. I'll let you know when I turn 54.
All right.
It's a lot harder when I'm past 50. I used to weight lift 5 days a week, and I felt great. I have trouble putting on my underwear these days, right? Like, it takes a different time,
Because it's
and you gotta
harder, you
sit
can't dig
down.
down. Like, is it both? What is the reason?
Oh, because I'm old? No, I was just gonna say, with age, our bodies age, and you can't do anything about that. But there's
Right.
never a point that's too late to get into fitness. Just know that if you're older, you need to spend more time on the mobility. You have to spend
Right.
more time on the flexibility. I need a warm up in the morning just to be able to lift a cup of coffee. But that's okay. You can incorporate that in different ways.
Well, that's right. But here's the thing. Like Europe has done a thing where they have said over decades, we're going to focus more on people being mobile, going to work, people like walking to the train, walking to the subway or metro, and that's their way that they get to work. And one of the reasons why they've done that is because they've recognized that this is more of a social type of construct of how we're going to get people more mobile. There's also a lot of evidence that shows that when you do have public transportation to different areas of towns and cities, you bring economic opportunity. But there's this other type of effect that people are walking. I mean, as you know, I'm in Europe all the time for work. And when I'm over there, every day I'm doing like 10 miles a day of just walking. And that's so dissimilar from when I'm back here in DC and I'm sitting at my desk most of the day.
Well, you also can't walk in the US the way in many cities, the way you can walk over here. Like, just out my backyard are tons of hiking trails. There are sidewalks. There are crosswalks. You go to the US and there's roads where there's no pedestrian area that's safe. Like, I'm always shocked when I get to the US about the number of cars, how wide the road is. Like, half the time over here, I'd rather walk than get in my car because I'm terrified I'm gonna, a lot of the streets are two-way, but they're only wide enough for one car. Like, that's really difficult for an anxious person.
Exactly. Well, but what we did as a nation is we traded individualism around the car and building bigger roads for more of a public mobile system that are moving people around. So that's one of the things where a public policy kind of decision really has impacted the health of us for decades. So I think the take-home point here when it comes to exercise is that, yes, you have to get out there, you have to move, you have to do things, but we can be helped by the infrastructure that's around us, the community that's around us, because going to the gym, going to get on a bike, buying a bike, those sort of things, they're expensive. And there are some other ways that we can have a low-cost solution. One is through public infrastructure, and one is trying to find a place where you can get out there and walk, with the goal being about 150 minutes a week drastically reduces your chance for cardiovascular disease, high cholesterol, diabetes, high blood pressure, stroke, and even people that have had those have a big significant reduction in those type of symptoms or those type of diseases. Okay, so
I want to go back to that because anybody who's listening who thinks that we're not sympathetic to something, and I think we should call it out. Social determinants of health are structural reasons why people really can't access healthy food, exercise, medications, healthcare, because of where you live, your income level, your, even within racial disparities. And so exercise is no different than any other reason that people can't access good health care. And I think we should call that out to say those policies go across the complete spectrum of healthcare, and we are sympathetic to that. But it's hard.
It's definitely hard. And I think the point here is we're sympathetic to it, and I'm sympathetic to it to the point where we need our legislatures to make our communities safer for exercise. We may need our legislatures and our policymakers to make communities and cities more amenable to exercise. I mean, here in DC, they've made a huge, big change to the amount of biking lanes. And you see a lot of people biking to work today. And fun fact, I did spin class this morning, and a guy was behind me. Now I drove this morning to spin class because it's several miles away. And when I drove, and there wasn't a place to park my bike. If there were, where I could park it safely, I'd ride my bike. But anyway, he had taken a city bike, and obviously he was not coming here to my house, but he was behind me at one point going to Georgetown Hospital. And I was following him, and then he was following me. He was on a bike, I was in a car. And then we got separated for some point in time, and about 5 minutes later, I'm passing the hospital. He's parking his bike, walking into the hospital. And it's like, okay, so not only has he been able to get a city bike, it was a city electric bike, make that movement throughout the city, he did it faster than the car, and he exercised for a portion of the time. So there's a big component to people's inability to exercise based upon the policy decisions and the infrastructure decisions of their community and of their cities. So,
Yes.
what does it take for the message? How do we make it more stable and the health of our population more stable when it comes to exercise? Talk to your congresspeople. Stop having them cut all of these funds for infrastructure. It's a big deal. So,
and I think private industry has a role here too. Go to your gym and say, you know what, if there's a crush for babies, how's a mom who's got a new baby who can't afford daycare supposed to get some exercise and a little social time? And then we're talking about like overcoming postpartum depression because you're back in society and you have an hour to yourself and you know your baby's right there. Like all these different things, they all tie together and affect our health.
exactly. Okay, next song, Sia, Beautiful People. Let's take it out. Now it's back in the 60s with a cadence. Now I want you strong on your right. I'm seeing your left foot go down first.
Huh? My left foot goes down first?
No, you're right. You're riding with the right.
I
I don't know
am?
if you can hear it. Well, yeah.
Am I supposed to have my left going down first?
Yeah.
I mean,
that's
they're
okay.
both going down. I don't know how you can say one is first and the other one's second because it's a chicken and egg phenomenon we got going on right now.
Oh, you will see when we do a spin class together, my dear. There is a difference between leading with the right
Okay.
and leading with the left.
There we go. Now my feet are left, right with yours.
That's there. We
Did
go.
that make all the difference?
Yeah, I'm in the low 60s on the cadence.
I'm at 65 with a resistance of 46.
Well, that's good. Good job. Keep it up. Push.
You're like, your resistance is what, in the 60s?
60, but that's okay.
Jesus. Women have different bodies than men.
Really? I didn't know that.
Yes, there
Yeah,
are
I'm
actual sex differences, and that's, we're going to get onto this next. Sex differences.
Okay, let's talk about it. Take a
in-
seat. Let's
Oh,
talk.
thank God. So, when they tried to cancel the Women's Health Initiative, here was, people don't understand. Women were not included in any scientific studies for years, for two reasons, primarily. One, you really don't want to experiment on pregnant women. That's poor form. And two, women's hormones, because of our menstrual cycles, for young women, not like me, they cause such variations in our response to certain medications, hormone levels, blood levels, tests, laboratory tests, that they just said, let's make it easy and kick the women out. But unfortunately, our bodies, if you are born and designated as a woman, it is different, and it does respond to medications differently. And it does respond to treatments differently, and diseases present differently. So when they canceled the Women's Health Initiative, outcry. And I think that's a great example of when the government does something you don't like, there is power in collective action. And Maria Shriver, I think she was key in this, because I think she called her cousin and said, what the fuck's wrong with you, Bobby? Or some
Right.
variation of that. Because I heard her speak recently, and she said, this is not the time to be afraid. This is the time to double down. And if we
Exactly.
work together, we can make things happen the way we want.
So when those anti-science voices, those anti-health, anti-education, public health voices speak loud, we do have to speak louder, especially as experts in the space of healthcare. It's incumbent upon us to do that. So I'm going to switch gears, no pun intended. Give me two more turns. to the right. I'm serious, I didn't see you turn up. Look, give me two more turns. There we go.
I'm
We're
supposed to do
starting-
2 full turns?
2 full turns, we're starting to climb. You're going to slow your cadence down, and you're going to push. Now let's talk about nutrition. So, I think that's a pretty unstable thing here in the US. Now, this may be one thing where RFK Jr. is right. What are your thoughts on that?
Again, yes, in Europe where I live, all your vegetables are labeled with what country they came from.
Okay.
And that's about planet, but also about knowing, how far your food has traveled, how long it was probably picked. Yes, we should all be eating less processed food. The ultra-processed food is frightening and directly related to the obesity epidemic. In communities that don't have access to that nonsense, you don't see the same obesity rates, the same health outcomes. When my kids want to eat that taco crap, the taki, right? The stuff that blue, it makes me sick. Now, if I completely restrict that, they're gonna hide it and do it out in the backyard with their friends, like crap.
2 turns to the left.
Oh, thank goodness.
Well, I mean, here's the thing, is RFK Jr. right about nutrition as far as on the we've got to eat healthier, we have to do that to control chronic disease?
Nobody ever got fat from eating blueberries.
True. However, when you've got the head of Health and Human Services complaining about vitamin B12 in food,
oh yeah,
that gives me a little bit more concern. Is he the right messenger for the nutrition movement?
Well, if you don't know that riboflavin, yes, it can be hard to pronounce. So can many words.
Sure.
But if you don't know what that is, you should be. If you're not, okay, let's back up. Let's say I actually thought he was the greatest guy for the job, and he wasn't a doctor or a scientist. Then I'd be like, I would expect him to surround himself with really well-educated people who really worked to make sure he understood what he was going to go on camera and say.
Exactly. I mean, we've had lots of HHS secretaries, CMS administrators, FDA chairs that have not been doctors, and so that's not a necessity per se. It's a nice to have, right? Someone that understands the provider role in the healthcare system, from hospitals to doctors to nurses, etc. But it's not an absolute necessity if, to your point, you've surrounded yourself with people that are competent and understand it. And what we've seen on the vaccine now committee is it's very questionable of whether or not he's surrounding himself with either sycophantic type people or people that are truly scientists that understand the space. So take home point here is that yes, nutrition is extremely important, but we have to be careful about what we're focusing on because there's a lot of other issues within our nutrition system. Yes, you have to get more vegetables. Diets with higher levels of vegetables are safer for you. They're better for you for your cardiovascular health, for your mental health. They are better for inflammation, etc. Reducing the amounts of bad proteins, I will say, highly saturated fats is a really good thing. Reducing your refined carbohydrates is a really good thing. But drinking raw milk because some Yahoo said that that's what you should be doing is not a good thing.
Can you say listeria?
Yeah, can you say
That's also a hard word to say. I want to go back to the social determinants of health conversation.
Sure.
Because if you're cutting school lunch funding, if you're taking away breakfast from kids who who have food insecurity at home, food insecurity is a real thing. And it's not just skinny kids. That's part of the obesity epidemic is related to food insecurity and not knowing where your next meal is coming from, and then eating as soon as you find food. If you take away those opportunities to, provide nutrition to developing brains, again, and when you go to a fast food restaurant, McDonald's withstanding at this point, and if crap in a bag is half the price of a cucumber, you're going to feed your kids crap in a bag.
Exactly, because that's what you can afford. So here's a role again for policymakers, is that for us to truly make America healthy, and I challenge to say healthy again, because I don't know, Laura, do you know a time when America was truly healthy?
I'm going to go back to the early 1900s when 1 in 10 babies, you had to have 10 babies because 1 in 10 died. And if you wanted to have like a surviving child, you had to have 6, 7, 8 kids.
Well, there's that. And also the lifetime expectancy, the life expectancy rates were much lower than they are now. a large portion because of the lack of antibiotics and vaccinations, et cetera. So as we are looking at this, to be healthy, it's really, I would say, a misnomer or a misstatement to say that we are going to be healthy again. Probably the healthiest we were as a country was just immediately before the pandemic.
Right.
And then we weren't healthy then. And I'm only using the number as age of life expectancy as the metric for that. I mean, we've talked about this in my class before, not spin class, but UNC.
Oh, business school class, the other class you teach, right?
The other class. We talked about the fact that, you know, we in the United States have this kind of exceptionalism where we believe at some level our health is phenomenal and our science is phenomenal and our healthcare is the best in the world. And there are some true statements there. But Europe and other countries are far passing us in life expectancy by years, and they're spending less money. So there's some work that we have to do, and I don't think it's quite right to say that we have to make America healthy again, because I'd really ask one of those people who has the again word in their Maha statement and ask them, so tell me a time when we were truly healthy. And I think that you can poke a lot of holes in that. So now I've got a question for you, directly applies to you. So one of the big areas of focus, and this came out in Politico recently, was how RFK Jr. has drastically changed the entire health and human services ecosystem, from funding cuts to changes in leadership, et cetera. But there's been a lot of concern about how good that is for our future state. So tell us about how that is directly affecting an entrepreneur, someone who's doing work in the women's health space. And we're going to take it out of the saddle for this one.
Oh, of course we do, because it's my turn to talk, so let's make the middle-aged lady breathless. And I will say there was also resistance and a very slow cadence in some of your classes in business school, buddy, but okay. I talk a lot about, I had an NIH grant funding meeting that was canceled 4 hours. We had practiced for weeks. I had put hours into that slide deck. And 4 hours before, and the problem is, I'm in a startup. Startups are terrifying because we don't make money. We are pre-revenue.
Right.
And that means we are constantly in the red, and you are constantly looking for funding. And if you think you're getting a check, and then that check is gone, that can actually change the entire future of your company. And if we want innovation, then we need to be funding that.
Correct. Well, I mean, here's the thing we have to think about, too. I mean, there's your company as one example. Take it back in the saddle. There's one company that's an example, and there's many, many others that are worried about, hey, how do I commercialize my product in the United States, considering the chaos?
How do we get a meeting with the FDA when
exactly.
so many phone numbers and emails are bouncing back?
Because people have left. I mean, it's thought to be more than 20% of the federal workforce around healthcare has been cut. Now, don't quote me on that number, but that was one that I read just a few months ago, and I'm sure that it's gotten worse. And what's happening is exactly what you've talked about, is that you send an email to someone, it bounces back, or the plan that was in place for you to go before the FDA or go to the NIH for a grant or to have conversations with CMS, those can't happen anymore because those people aren't there anymore. And the number of people that were there to review products, to work with you on the review of products and services, many of them are gone. So whether the people are gone or there's not enough people to manage the capacity of new innovations that are coming in, that has a big knock-on effect to our future state of innovation. So something to watch for. So I have real concerns about that.
And I think we've pointed this out before, but these are often highly specialized positions that require a lot of training. Like, you don't just graduate from college with a degree in sociology and go work for the FDA reviewing drug applications. Right?
Correct.
So you just willy-nilly fire people. Well, then you have to kind of eat crow and hire them back, or you just go without.
Exactly. And that's where I think other companies are starting to see they may have an opportunity to usurp the position of the United States as a country of innovation and establish themselves as new hubs of innovation, which is not necessarily a bad thing from a global perspective, to spread out innovation, because you really want everybody to become more innovative. But what we do have to recognize is that that takes time for those countries to gear up and those factories to work. So we talked about nutrition, we talked about exercise, we talked about misinformation, we talked about the funding environment, as well as the cuts that have happened in HHS. What else can we talk about ma ha 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 ha?
Ma ha 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 ha.
Take a seat.
Thank God, because now I gotta think. You know, I think that we need to tell people that just because something crazy is coming out of the top doesn't mean that you can't access trusted sources of information. Primary care is if we can fund it, and that's also a real problem, if getting access to it. But there's a lot of innovation in that space. Most doctors want to do the right thing. They don't want to deceive you. They want to give you good information to keep you healthy. Nobody wants children getting sick. We just don't. Most of us are good people. So find those sources, and your source is not Google. Your source is not Gwyneth Paltrow.
Or ChatGPT necessarily. As we've, side note, seen with the Make America Healthy Again report, it was riddled with sources that did not exist because it was created with AI, and AI had some hallucinations, but...
Let's talk about the limitations of AI for a moment, okay? I asked AI to take a photo of me and a handbag and Photoshop the handbag onto my shoulder. And what I got back was a very cross-eyed looking myself with a purse on my shoulder, but there was a little hand sticking out of the side of the bag. It made me a handbag. So...
It's quite literal, Laura.
It's very literal. I mean, I was kind of impressed.
Wrong.
But let's just say this. AI will have a place in medicine, but it's not there yet. And until...
Well, okay, I'm going to push back on you on that. It is there. It's already been there. It has been going on for decades. Take, for example, our EKG machines.
Yes.
And
they're damn smart. Oh, yeah. I don't know how to read an EKG.
However, even though that it has been there, there's a requirement to have a human oversee and look over that information to ensure that it's accurate. And that's why we still need to have smart people and not just depend on AI.
Take it completely back. Unregulated, unsupervised AI is not there yet. And if if any one of us had given a patient, diagnosis and prescription plan that had 50 false citations in it, we'd be fired immediately.
Well, exactly. And that's what's scary, that's coming from the top, is that not only are they spouting misinformation, but they're putting out official government reports talking about the health of the nation and their plans that is riddled with errors, riddled with disinformation, misinformation, and right out falsehoods, because it was created with AI. So we've got some work to do. So let's take a cool down. We've been about 34 or 35 minutes. I don't know how many calories that you've burned in this last 30-ish minutes.
Mine didn't tell me. I did 10.28 miles, 261 calories it tells me, but I think that's a lie. I think it was at least 7.
No, I mean, that's great. I've done 9.37. You've gone faster than me.
I have. Did you notice I was breathy?
Well, okay, sure.
Not in a sexy way.
Well, but I did 16 miles this morning. We're competing right now.
I lifted weights. Now it's a competition.
Weirdos.
Huh?
See, competition is good. I just will say, one of the things that I love about going to the gym, love about teaching spin class, love about being at SoulCycle or a spin studio, is that energy you get from other people when you're working out that kind of pushes you. And then, when I get up early to do a spin class at like 6:30 in the morning or 7 in the morning, it's one of those things where it's like, oh, I want to just go back to sleep. But I really do know that as soon as I get through that class, I've burned the calories for the day, I've had a really good time, I've made some connections with people. There's that competitive, I'll say competitive energy, but not in a negative way. Like, you really are trying to build other people up and yourself up. And then you kind of get into class, you're like, okay, I'm done for the day. And it's It's pretty amazing. It's pretty awesome. So,
Yeah, whatever works for you. I follow an app that tells me what my workout is every day and when my rest days are. And I'm so anal that if I don't get to check every box, like I get really bent out of shape. So that's what I'm using right now.
Exactly. I mean, I think that's another way of kind of that gamification of keeping you healthy. So, we talked about a couple of ways that you can stay healthy, whether it's like walking more, trying to be in a park or a community that allows you to do that. Of course, that's very challenging. There are some things that you can do from home. We've talked about some nutrition, eating more vegetables, reducing down your saturated fats. But that's also challenging if you are restrained on your economic resources, because the system right now is pretty unstable around nutrition and not set up in a way that helps people eat healthy. We've talked about the concern around misinformation around vaccines and the concerns from the leadership at the top around health and human services right now and public health. We've discussed the cuts that have happened and the real concerns. I mean, when you kind of take all these different pieces, Laura, it's pretty overwhelming.
It's overwhelming, but you know what? Dear public, you have me and Dr. Adam here to give you truth while we work on our glutes.
Truth, we're working on the case.
And glutes.
Exactly. Well, listen, this has been a lot of fun.
Yeah, thanks for that. Really enjoyed myself. I did, actually. It was a good time. I want to do this again soon.
Have a wonderful day, Laura.
Okay.
I will talk with you soon. All right, see you.
Bye.
Bye.
Thanks for tuning in to Unstable Vitals. If you enjoyed this episode, make sure to follow us for more unfiltered conversations on the pulse of healthcare. Connect with us on LinkedIn or visit unstablevitals.com to stay in the loop. And don't forget, real change starts with real talk. See you next time.